Hello, this is Jerry Baker, and welcome to my presentation, Controlling Prosthetic Limbs, the Ongoing Struggle. So there are 185,000 amputations that take place in the U.S. every year. Medical experts and scientists work hard to ensure the quality of life of these patients, and part of that is involving prosthetic limbs. So right now, one of the themes going on is patient comfort and ease. So on top of losing a limb, by going through the surgery, mental trauma and depression can also occur. And because of physical pain and phantom sensations, many amputees abandon prosthetic use altogether. And so patients need to know that the prosthetic limb will be comfortable and easy to use. One survey conducted by getting opinions from different amputees showed that 83% only responded positively to the least invasive control techniques. And even though there were more advanced features being offered, that the most basic stuff, such as just opening and closing a hand, were still the things that people really cared about, without caring about fine motor control or touch, anything like that. And it might be kind of disappointing, but it does show that people need to be able to trust the basics before they can be willing to do surgery or anything to get a prosthetic under control. The second theme that I have is intuitive controls. So evidence shows that acceptance of modern prosthetic limbs would increase if the control system offered sensations of touch and joint movement, which is contradictory to theme one, that's another thing, and a more natural control mechanism. So if a control could approximate a biological limb, then people would be much more interested in that. Implanting electrodes into nerve stumps has been shown to produce the sensation of touch or movement in the missing hand. When electrodes were inserted and the subject was asked to flex a finger in their missing hand, the electrodes recorded the nerve activity during the response. And using this data could be a huge start and could be pretty cool in the future technologies that come about. Current prosthetic technology does not allow much for tactile feedback, so the current strategy is visual feedback. However, that is not enough to continue by itself. One thing that is crucial for prosthetic control is kinesthesia, which is the awareness of the position and movements of your body and your body parts. And since prosthetic limbs also do not offer kinesthetic feedback, the perception of movement allowed the amputee's motor control loop to improve function without additional feedback, such as visually seeing where the arm was. So ultimately, there's a lot more research that needs to be done, and things kind of contradict each other. But there are positive results that are coming out of here. That's just happening pretty slowly. And my third theme is EMG signals, or electromyographical signals. They're biological signals that measure electrical currents that generate in muscles during muscle contraction. And these can be measured through electrodes that are placed either on the muscle itself or just on the surface of the skin. And as the technology is advancing through the years, engineers have been able to help users perform more delicate grips and have varying intensity of grips when controlling prosthetic hands because they can get the EMG data. The signals can also be used in mapping out healthy movements from individuals with all their limbs and try to get those data to match with someone using a prosthetic limb. One thing that a lot of people are attempting is also utilizing cloud technology to transmit this kind of data outside of clinical studies over Bluetooth or Wi-Fi. This method is still in its infancy, but it's showing a lot of promise. Technology is making leaps by taking in user feedback and understanding what amputees are looking for in a prosthetic limb. And in conclusion, advanced control of prosthetic limbs that come off as natural to the user, there's still a lot to learn. Progress is slow due to relatively few test subjects, perception of prosthetics being a painful experience, not knowing how to transmit data quite yet, and hopefully in the coming years we will get some of these problems taken care of. And this has been my presentation. Thank you very much. And here are my citations.